Welcome, everyone. I want to thank you all for joining us today to learn a little bit more about SHAC, our Student Health Action Coalition. We're here today because today is Tar Heel Tuesday, a day where we get to highlight some of the amazing programs that we work with here at UNC Health Foundation. And today we're going to talk about SHAC. My name is Mary Liz Entwistle, and I have the privilege of serving on our medical education team here at the Health Foundation, which means I get to work with our fantastic students, both in medicine and in the health sciences. And many of these students volunteer in a program called SHAC that provides essential health services to our community. And so today with us, we have the CEOs of SHAC. We've got Aaliyah Capone and Akshatha Kiran, who are going to introduce themselves in just a minute. So thank you all so much for being with us today. Would you like to, I'm going to have you go first. Just share a little bit about your background, what year you are in school, and how you got involved in medicine and SHAC.
Hi everyone, my name is Aaliyah. I am a fourth-year medical student at UNC. I'm from Cary, North Carolina. I've pretty much lived in North Carolina almost my whole life. Went to UNC for undergrad, and then I took 2 years before med school, one doing research in cardiology, and then another year serving up in Philadelphia with AmeriCorps, with the National Health Corps. And then I came back down to North Carolina for med school, and I just knew that I wanted to center my med school experience around service and working in the community. And that kind of brought me to SHAC. During my first couple of years of med school, I volunteered in multiple capacities as one of the med team juniors, like learning my interview taking skills and kind of developing history taking and physicals, and then also through STI and HIV testing and counseling, and with our triage team. And then a few years later, after all of that involvement, I decided I wanted to take my involvement in SHAC a step further. And so I applied to be one of the CEOs. And I'm so glad I did that, because I feel like it's really brought things full circle for me, to get to kind of oversee things and support my peers and their awesome projects and initiatives, and get to really grow in my leadership skills and my teammate skills, working with my lovely co-CEO, Akshatha. And I am also excited to say that I am applying into family medicine for residency. And I think that really my experience with SHAC and with AmeriCorps kind of helped me to choose family medicine, because I think that working in the community and justice work and health equity, and really advocating for marginalized groups is so integral in being a primary care physician. And so I'm really happy to be pursuing family medicine and happy to be here with you all today.
Thank you for joining us today, Aaliyah. Akshatha, would you like to introduce yourself as well?
Yeah, absolutely. Thank you. Hi, everybody. My name is Akshatha Kiran. I am a second-year med student here at UNC. I am also from Cary, North Carolina. Aaliyah and I think grew up less than a mile away from each other. So we've really come full circle in that. Before starting at UNC, so I started in 2020. I got my master's in public health in health policy from the Yale School of Public Health, where I volunteered with the Yale School of Medicine's version of SHAC. So their student-run free clinic is called Haven, and I worked as the clinic director there. My experience between the clinical and health policy realms during my 2 years there really spurred my involvement in SHAC when I came to UNC, and it's pretty much what brought me to medical school and into this experience. At SHAC, I really saw the potential for getting to use our clinical training as kind of a lever in advocacy for our patients. And so through this position, I wanted to learn more about what advocacy and supporting health equity looks like in practice. And so we worked on kind of how to reach our patients who are falling through the cracks of this health system, even though there's such a robust one here in Orange County. And it's really been the most defining experience of my time here so far. So I'm really excited to see how I'm able to apply these lessons and see what other challenges kind of come forward in the next 2 years during my time at UNC.
Thank you. To our guests on the webinar, I know some of you have pre-submitted some questions, but if you have any questions for our speakers at any point throughout the presentation, please submit those through the Q&A box on the Zoom webinar platform, and we'll be answering those towards the end. We also have a trivia question, and the winner of this trivia competition will win 2 tickets to the UNC versus Furman men's basketball game. So that's very exciting. Our first trivia question is, how many departments are at SHAC? And again, you can use the Q&A box to submit your answers to that trivia question, and we'll be announcing the winners at the end. Now I'm going to turn things back over to our student leaders to tell us a little bit more about the background of SHAC and what's been going on, what's going to be happening next.
All right, thank you so much. So just wanted to kick things off with an agenda. So we're going to touch on kind of where SHAC started, where we are today, how we're kind of functioning today, and then wrap up with a look into the future with projects that we have on the horizon. So SHAC was founded in 1968. It is the nation's first and oldest student-run free clinic. Over the years, it's been staffed by students of UNC's many health programs, including medicine, pharmacy, nursing, and dentistry. It's grown in size over the last couple of years that Aaliyah will touch on here soon. And while the Med Clinic still operates as SHAC's largest department, the coalition of SHAC has grown over the last 53 years to support 3 primary goals listed here on this slide. SHAC stands for the Student Health Action Coalition, and true to its name, it really functions as a larger entity than just a medical clinic. So our main goals are to provide health services to our underinsured neighbors here in Carrboro, Chapel Hill, and Durham. We really want to partner and dedicate our time to partnering with local communities to be able to implement really sustainable programs that value accompaniment. And we want to cultivate an interdisciplinary service learning environment for students here at UNC, no matter what their background is, whether they're in graduate school or are actually also in the undergraduate program. Next slide, please.
So one of our many programs at SHAC, and the one that people often think of when they think of SHAC, is our medical clinic. And so we just have some statistics and numbers to show you that from 2021 so far. We've had 610 visits in 2021. And this actually kind of just taking a step backwards. So the pandemic, like most health institutions, kind of hit us hard. In 2020, in the spring, we shut down for a few months, and then we were actually able to gear back up in July 2020 and started providing services again through a virtual platform, and then slowly but surely started ramping numbers back up. When we started our tenure in January, we were seeing the med clinic, the acute clinic was seeing 4 patients per night. And then over the next several months, I think in about August, we got back up to our pre-pandemic numbers, which was at least 12 patients a night. And that is really a testament to our students that run the clinic, our med clinic directors, and each of the directors in the other programs at the clinic, as well as our faculty that support us. At the clinic, we predominantly serve the Latinx community. I think definitely over 50%, maybe even 60% of our patients speak Spanish. And then just some other demographic numbers. Our age distribution is predominantly, I would say, like pretty young, 20s, 30s, 40s. And I think that probably comes from the standpoint of we are capturing uninsured and underinsured patients. And so once we hit kind of like that 65 number and hit up into Medicare, there's a lot of other resources out there for patients who are on Medicare. And so I think that's what really drives our age distribution to be a younger adult population. And then our gender distribution, you can see in this slide, is pretty well split between females, males, and then a small portion of other. And then kind of what Akshita alluded to is that we really are more than just our acute medical clinic. And over the last 53 years, we've really expanded to have 19 programs in total. And so this image right here kind of shows that we have like our clinical care, that all of those programs are kind of nestled within our medical clinic that we have on Wednesday evenings. But then we also have these programs that are really about community outreach and strengthening ties in the community. Next.
So we wanted to take this opportunity today to highlight a couple of our departments that are unique to SHAC. Having served at a variety of student-run free clinics in the past, I've kind of seen what makes SHAC so special. And so wanted to share that with you all. Whether you are a SHAC alum or just hearing about SHAC for the first time, these programs are just examples of what really brings SHAC to be a member of the community and not its kind of own standalone entity within this larger health system. For example, we have our outreach program. This is conducted in partnership with students from UNC's Eshelman School of Pharmacy. Our students go together to St. Thomas More here in Chapel Hill, and they visit churchgoers twice a month. Usually they're also present in Durham at the Urban Ministries. We're kind of reopening that partnership after the pandemic. So they tend to provide primarily preventative services and work to kind of give us referrals to SHAC so that we can then connect patients with long-term care providers at Piedmont Health Services. So some of the services that they provide at St. Thomas More right now include blood pressure and blood sugar measurements. They teach patients how to take them, the importance of them, lifestyle modification counseling, medication reconciliation, and helping patients create personalized health plans based on both the goals that they set for themselves and the ones that they work with their providers to set once they are at PHS. Next slide, please. Thank you. Another new program that we initiated this year, which we are super excited about, are our social needs navigators. Part of the way that SHAC has been evolving over the years is to try to approach patient care in a more holistic manner. And so our social needs navigators are really crucial in this because once patients are screened, once they enter SHAC and they're screened for any sort of social need or social support that they might have, we make sure that they are receiving those. So right now we have protocols set in place for patients who are presenting with food insecurity, for housing insecurity, whether they need help with securing a safe space to live or they need help with making payments, if there are issues with domestic violence or they are feeling unsafe at home, if they have financial assistance needs, mental health that is then subsequently passed on to our mental health team or escalated more so as needed. If they need support with transportation, whether that's to get to SHAC or to get to work, if they are trying to obtain insurance, we have a separate department that helps them kind of apply for insurance or apply for charity care, which is UNC's program for financial support to obtain health services. And lastly, also if they have legal concerns, we've started a new partnership with UNC's law school that's underway to help patients be able to navigate kind of the legal concerns that they might be facing. So that's kind of a work in progress right now, but that's all embedded within the social needs navigators that accompany patient visits. Next slide, please. And our third highlight of today is our gender affirming care clinic. So our clinic here really works to provide a safe haven for trans and queer patients. Many of our student providers are trans or queer. They predominantly also speak Spanish, and our providers are well-trained and well-equipped in doing so. Some of the services that they offer are prescriptions and funding for hormone therapy. This has been particularly exciting for our patient population because through the clinic's funding opportunities, they've been able to provide fully funded hormone therapies for 70% of all GACC patients. And that's 80% of all the patients who are presenting with need to the clinic. And their list is always growing. They have one of the lengthiest wait lists, even as they're working through them pretty quickly. And so we're excited to be able to support them further in the future by bringing in more funding to be able to support and offer those services to patients and kind of be able to work through their wait list so patients can get the care they need. They also provide general primary care. They provide letters of support for surgery, and they are able to connect patients with other referrals within SHAC and within the larger Orange County community at large.
So within our gender affirming care clinic, we just wanted to highlight an awesome initiative that our leaders came up with this year. And I think they realized there was a need that really all volunteers, all student volunteers, as they come into the clinic, should really be trained in appropriate and inclusive language and situational awareness for working with the queer and trans population. And so, and that is kind of extends beyond just our gender affirming care clinic, but also, every patient that walks in the door, we want to be inclusive towards and open towards. And so we kind of decided with our gender affirming care clinic leaders that we wanted to create this requirement across the board for all incoming, this was an initiative that we started this year, for all incoming students that were going to want to volunteer at the medical clinic in any capacity, to be trained to attend this training, and which has been super successful because 120 students have been trained since May 2021, and we have ongoing trainings, several throughout each semester, planned with awesome attendance. So it's something that we're really proud of. And then kind of just going, Akshita will kind of touch on some of our other improvement and quality metrics that we have been working towards the next or this year, and things that we're really excited about.
So kind of going off that note, while we are trying to improve the way that we're interacting with patients, we realize that managing quality at a student-run free clinic is really important. All patients should have access to high quality care, and in a student-run free clinic environment, we are working within the constraints of a resource limited setting. And so despite having to kind of navigate the challenges that come with that, we really strive to ensure that we are able to provide the best quality care that we can to our patients. And in doing so, we have started a dedicated focus on collecting different metrics to figure out how we're doing and how we can do better for our patients. These are just some examples that we have of data that we've been collecting for the last year. So we've been collecting both quantitative and qualitative data to better understand in terms of patient numbers, so we're able to kind of share the impact that we're having with the community, as well as really focus in on the patient's experience with us. We want to make sure that patients feel supported and cared for and comfortable in the SHAC environment. And so not only are we looking at levels of care based on utilization, the number of follow-up visits, how many patients are lost to follow-up, whether they are or are not using the services that we have on hand, as well as what other services we could be providing that patients need, the referrals that they're making to other members of their community, and patient understanding. Health literacy is a challenge within any patient population, particularly within ours, that is underlined by the language barrier that patients often face. And so we really strive to ensure that our patients are not only receiving care, but are understanding both their conditions and the treatment options that are at their disposal to receive the best care possible. Next slide, please. Thank you. Another initiative that we've had is revamping the entire website. So we overhauled the website this year thanks to our stellar IT department. That is again done by SHAC students. And so the website that you can see, there's a little screenshot here on the left, is now available in both English and Spanish. You can scan this QR code here to visit our website. We also have the QR code available in a special surprise later on in the presentation. For the work that we've done so far, we have received accreditation per the gold standard for the National Association of Free Clinics for this year. We intend to pursue this accreditation again next year. And we'll kind of keep working on improving what we're able to offer to patients to make sure that we're meeting and are on par with other clinics around the country. Next slide, please. Thanks. Oh, we can actually hit the next one too. Thank you. Another key focus that we've had for this year is reaching patients more intentionally. We realize that the pandemic created a lot of challenges and stressors for the health system, as well as for patients, because all of a sudden, all of the resources that they were relying on kind of disappeared or became inaccessible. And so our really exciting project this year has been rolling out this advertisement on the Chapel Hill line. This is a bus that is actually in transit as we speak. It just came out in, I think, the last week or so. So this is a free line, and a lot of our patients do use this line, and it travels between Carrboro, Chapel Hill, and I believe also Durham. So patients can scan the QR code that's available on the side of this bus to be able to visit our website and make an appointment. We're super excited about that and are looking forward to kind of using this as one of our campaign strategies to be able to reach more patients and bring people in by making the services known and available to them. We are also available on North Carolina's 211 phone line. Patients can make appointments that way. We are waiting for approval through the NC Care 360 system, which is the statewide portal that's available for patients to be able to navigate different resources that are in their area. This was stood up during the pandemic, and so we're really excited to be able to join the team on that front. We are available on all forms of social media. We have a very active social media campaign out right now, and are also receiving patients that way, as our patient population seems to be younger and is likely using different forms of social media. We're trying to adapt to meet with them. Another marketing strategy that we have currently but have not yet been able to implement is sharing our services and availability on different forms of radio. We've been looking into different radio stations in the area. Unfortunately, a lot of them right now are a little bit out of our reach due to different financial constraints because of our limited resource setting, but we are working on that to make sure that we're able to reach patients in any shape or form that we're able to. Next slide, please.
Yeah, and kind of just to touch on that too, is that ad that we just started running for the bus, is we have that, I think, just for a few months. And so it costs money to kind of re-up the ad. And so we're hoping that it really brings in even more patients, and that is something that we would like to continue doing, but would always benefit from extra support financially to be able to continue promoting SHAC in the local community. And then some other future initiatives that we have that are really one is in like super preliminary stages, and then one is further along. So our one that I'm super excited about is our syringe exchange program. And this was going to go into effect in November of this year, but I think it's just getting pushed a couple months for some like administrative reasons. But basically, the goal of this program would be to provide safe access for community members who use needles. And basically a syringe exchange program provides clean needles for patients who are using needles. So it's a harm reduction kind of strategy. And also within this syringe exchange program, we would like to promote education to community members and volunteers on naloxone or Narcan use. Excuse me, I have a little friend that just wanted to make an appearance. And then also we would like to offer kind of bridging to providers who provide medication assisted treatment or Suboxone. And so that should be coming up in the next couple of months, and would be a program that is offered in Carrboro. Not at our clinic, but at another kind of location locally. And then the other initiative that we are looking forward to, and is in really preliminary stages, is our creating a community advisory board. And we think that this is so important to actually get input from the patients that we serve. And this would better strengthen community ties. And also, I think sometimes we think that we know what's best, but we don't actually know because we're not having these lived experiences, especially, living as a member in a marginalized group or suffering from different health disparities. And so what we would like to do is create this community advisory board to be able to better listen to and understand diverse ideas from the patients we serve, and then also to enhance the services that we provide for the community. And kind of both of these things really would also benefit from funding and donations, because like Akshita said, all of our services are really volunteer run, but they would really be able to thrive even more with more funding, and especially with a community advisory board. Like a lot of our patients, if we were to have them come on to an advisory board, you know, we would want to be able to compensate them for their time. And to be able to really do that, we would need extra support. And so really, you know, throughout Targeal Tuesday, this campaign initiative for funds is really important to us as SHAC, because it really is what keeps kind of the wheels turning of our organization. And so we really appreciate any support that you all can give. Thank you.
Thank you. Now we're going to transition into our Q&A portion. If you have any questions, you can still submit those through the Q&A box on Zoom. But first, I get to announce that our first trivia winner is Bobby, and you will get an email after the presentation today. And then our first question is, can you all talk a little bit more about the relationship between SHAC Medical and SHAC Dental Clinic?
Sure. So SHAC Dental is kind of within our umbrella of SHAC, but they actually run pretty independently. The clinic is located separately. It's not part of our like normal Wednesday night clinic. And it's totally run through the dental school. And they see, I'm not sure the numbers of patients that they see, but they really serve a wide or a very large number of patients and always have a very long wait list. But we have really this year been trying to strengthen our ties to the dental clinic with our community programs to kind of increase referrals to the dental program, to expand access for dental care in the community.
And you highlighted a few programs in your presentation, but what do you see for the future or expansion of SHAC?
We are really looking to make our community-based programs more robust. We have a lot of support kind of coming in from the hospital and from faculty for our medical clinic and our medical departments, which has been phenomenal. They are so strong and so amazing. And so while trying to support patients who are receiving kind of medical care and clinical support from us, we also want to make sure that our patients are receiving holistic support that they may not be able to find elsewhere, because sometimes you aren't really sure of what resources are available to you unless they are presented to you in kind of a clear way. And so that's kind of what we're trying to build for our patients, is a more clear and accessible route to the resources that they have at their disposal.
Next question is, what's the role of medical students in SHAC today? And this is from someone who participated in SHAC before, wants to know, are students still taking histories and checking blood pressures, for example?
Yeah, so that role totally still exists. Our medical students pretty much do intake of our patients and then kind of run the whole visit. And it really is like fully student run. The only friend, again, sorry about that. Oh, so I think really it's totally student run, kind of from even just like the front desk intake, blood pressures, labs, and then doing the full history and physical. And then the students then come out and present to either a resident or an attending. We have one of each who is on site kind of as the supervising physician each week. And then they will usually pop in just to say hi to the patient and, you know, express any other like treatment changes. But really it is like fully student run, which is super awesome. And then I also wanted to just touch on really quickly from before, the kind of expansion of SHAC. We have an opportunity, some students in our Keenan Urban Scholars Program really who are moving into the clinical phase of their medical school time into third year and fourth year. They really wanted to expand SHAC into Raleigh. A lot of students volunteer with urban ministries in Raleigh. And so they wanted to kind of they saw a need for SHAC to kind of amplify the services in Raleigh, especially in the evening hours. And so we're really in super preliminary stages of that, and talking to faculty and gauging involvement and support in that sphere.
And then finally, can you talk a little bit about SHAC's clinic population today? And patient population, yeah, is what I should say.
Yeah, absolutely. So Aaliyah touched on this a little bit earlier. When SHAC started, it was predominantly an African-American population that they were seeking to serve. Over time, this has since changed. Now we predominantly serve a Latinx population. Most of our patients, their first language is Spanish. And so we have a really large interpreter population that is available, or interpreter students that are available to be able to support with this. Our patients are still predominantly, they're all low income, they are under or uninsured, and we do what we can to be able to kind of make sure that we're connecting them to other resources. Does that answer your question?
Yeah. Okay. Thank you. Yeah. Now we have another question for our audience. There's another chance to win one of our trivia prizes, and this question is going to see if you were paying attention to our fantastic CEOs during their presentation. What is the name of the building that SHAC Medical Clinic operates in? So again, you can use the Q&A feature to submit your trivia question answers. While you all are doing that, I want to thank Aaliyah and Akshatha for not only your time today, but for all that you're doing to help reduce health inequity in our community and serve these patient populations that have such a need for the work that you're doing. And we really appreciate all of the work that you do for SHAC to keep it growing, and all the new programs and initiatives that you're working on with your teams. And then I believe we're going to have some more slides to talk about some of the resources that we have with SHAC. So if you know anyone, or if you or anyone you know is in need of SHAC services, the medical clinic operates on Wednesday evenings, and you can use the website below to reach those services. And you know, as the CEOs mentioned, they want to provide services to as many patients as possible. So getting the word out about SHAC and SHAC's mission is of the utmost importance. Today is Tar Heel Tuesday, and so it's a great day for us to generate some more support for SHAC. Our goal today is to raise $1,500, which would cover the cost for 1 full year of essential patient, medical, and programmatic expenses, which is fantastic. And you know, we want to be able to do even more. So you can go to unchf.org/support-SHAC to join us in making your gift to SHAC on this Tar Heel Tuesday. You can also see on our Tar Heel Tuesday page all the many other causes that we have to support on Tar Heel Tuesday at the Health Foundation. I'd also like to ask you to fill out a short survey when you sign off, and today's webinar will be recorded and will be sent to you by the end of the week. If you have any questions about SHAC, please feel free to reach out to me. I'm happy to connect you with our CEOs here, or any of the clinic leads if you had any specific questions about any of the particular programs within SHAC. It's the work that our students are doing is so great and so fantastic, and I feel like I can't say enough good things about what we're doing here with these students. So thank you everyone for being with us today.
Thank you so much.
Thank you so much. We really appreciate it. Thank you for letting us share.